Hi, my name is Kate Crosby. Today I will be teaching about lung cancer prevention and I will be targeting the age group of 13 to 16 years old. First, we're going to look at some basic anatomy and physiology. Lungs are the organs in the body that help us to take in oxygen and get rid of carbon dioxide. The right lung has 3 lobes and the left lung has 2 lobes. The pathway that air takes is it first comes into our mouth and nose, then to the trachea, then to the bronchi, then down to the bronchioles, and lastly to the alveoli. The alveoli are the small air sacs at the very end of our lungs where the gas exchange between oxygen and carbon dioxide takes place. Let's take a closer look at what lung cancer is. Lung cancer is cancer that takes place in the tissues of the lungs. The cancer typically begins close to the bronchi or in the bronchioles or alveoli. There are 2 main types of lung cancer: non-small cell lung cancer and small cell lung cancer. Lung cancer is the leading cause of cancer death in both men and women. Lung cancer can also spread to other parts of the body. This is called metastasis. Some signs and symptoms of lung cancer include a cough that won't go away, chest pain, shortness of breath, wheezing, coughing up blood, weight loss with no apparent reason, and fatigue. There are many risk factors for lung cancer. Factors that you can control include tobacco smoke exposure, secondhand smoke exposure, radon exposure, asbestos exposure, and arsenic in your drinking water. Factors that you cannot control include previous lung radiation, air pollution, and a personal and family history of lung cancer. Next, we will talk about the connection between e-cigarettes, vaping, and lung cancer. E-cigarettes are electronic devices that contain a liquid mixture and produce an aerosol. Using e-cigarettes is also known as vaping. Majority of these devices contain nicotine, which comes from tobacco. Tobacco smoking is the greatest risk factor for lung cancer. Let's talk more about e-cigarettes and the possible side effects from them. Not all e-cigarettes are created equal. Some contain more chemicals and toxins than others. These toxins have been known to cause damage to the lung tissue. Diacetyl, a buttery flavoring agent commonly used in e-cigarette liquid, causes scarring in the bronchioles of the lungs. This scarring is known as bronchiolitis obliterans, or popcorn lung. The treatment options for lung cancer include surgery, chemotherapy, radiation, targeted drug therapy, and complementary and alternative therapies. The greatest thing you can do to prevent lung cancer is to not smoke or vape. The CDC states that cigarette smoking causes about 80 to 90% of lung cancer deaths in the United States. Other ways you can prevent lung cancer include avoiding secondhand smoke, lowering exposure to radon, and lowering exposure to hazardous substances. Here are my references. Thank you for listening, and I hope you were able to learn some helpful facts about lung cancer prevention.